Hey there, welcome back to Sanctuary. So I wanted to post this particular video because once again I have witnessed certain first responders and caregiver staff and care providers completely misinterpreting an incident and a patient's issues and continuing to treat the patient as if they have and are doing something that they're not. Completely misinterpreting the whole situation, misinterpreting the behavior, the symptoms, completely ignoring what they're told about the situation. And this was a medical emergency. Another one, I have witnessed this so many times over the years, and it's got to stop. It has to stop. It's ridiculous. People's lives are at serious risk. So empathetic intelligence, of all the jobs that absolutely require empathetic intelligence, care providing, first responders, and caregivers, they're at the top of the list who need to have it. Regardless of what job it is, and what education level, and what ancestry, and what belief system, and what political party, it doesn't matter. If you're going to be treating one of my family members or friends, or your family members or friends, empathetic intelligence, you have to be able to interpret what's going on with normal empathy. So what I'm saying is, you do not treat a person, for example, who is seizing as if they are having some kind of behavioral episode. Okay? Now, this has got nothing to do with politics or wokeism or anything like that, and anybody that knows me knows much better than that. So please don't interpret it that way. This is absolute basic. So if you're a veterinarian, and by the way, I have personally known veterinarians who lack empathetic intelligence as well, and they harmed the animals. Okay, that's what happens. If you lack empathetic intelligence, you are at high risk of harming a patient and completely misinterpreting what's going on. And then you're going to relate and relay an incorrect story and incorrect information to the next caregiver and care provider, and you're going to put wrong information on a chart, and you're going to mess up professionals who do have empathetic intelligence because you're leading them in the wrong direction. So if you don't have empathetic intelligence, you're probably not going to know it. So this isn't actually even just an individual issue. This is a management issue, a training issue, a college issue, whatever the training facility is, whatever the place is. I have witnessed this way too many times, where a caregiver, care provider, a first responder, they're not doing their job. The urgency isn't there. The basic interpretation of the situation isn't there. And I just witnessed it again, and this person could have been in serious jeopardy if the facts hadn't been set straight for the second set of care providers at, the facility, at the hospital. So, and the information was very clear. It was given and given and given very straightforwardly. It was like they just didn't believe what they were being told and what was right in front of their eyes, what they were witnessing. It's really important, whether the person is a paramedic, whatever their job is. from paramedic to, doctor, police officer, caregiver in a nursing facility or in a group home, management. You've got to have empathetic intelligence so you can accurately perceive and be objective about what's going on. You cannot jump to conclusions and then project like bad behavior or bad character or criminal, whatever it is, onto the person. I've also witnessed this in death. I'll tell you a little story real quick. My roommate passed away. He was a super nice guy, fisherman. Wonderful family, very humble people, very kind people. He was a really close friend of my friend. That's how I knew him. And he had some kind of, it was a congenital heart defect. And he thought he had the flu. And it ended up being that, and he passed away. He was only 36. And the police investigated, the local police there, with a SWAT team attitude when they showed up after I called 911. As if he was a drug dealer or something. As if this was that kind of situation. And this is not where he passed away. In his home was not a big city. There is no reason to act that way whatsoever. Small town. It was just absolutely shocking. And the way they treated his family, it was horrific. And it wasn't all of them. There was a couple people there, first responders, that were really decent people. It was the other ones, the ones that showed up. I don't know what they thought. They were like, why would you assume that? So yeah, be cautious, protect yourself, but you don't come in guns blazing when you don't even know what happened and like project all this stuff onto other people. You're just not doing your job. Okay? Just not doing your job. And you're messing up the professionals that are doing their jobs. And yeah, I speak from experience. Don't mess up people that are actually doing their job with your projections and bias and assumptions. I've been with a patient who had Todd's paralysis, and what that is a seizure. It was caused by something, and the person has garbled speech after that. Well, they were treating her in the hospital like she had dementia instead of what she had. So they weren't treating her. Do you see how that works? You can't misinterpret like that. You can't make these broad, giant assumptions. And they were like, oh, she's a la la la, she's so cute, look at her. I'm like, what are you doing? This was from a seizure. And I had to, why would I have to set them straight? They weren't treating her. And if I didn't catch those remarks, I wouldn't have realized. So you've got to look out for your family. You've got to look out for your friends. I have so many examples and so many incidents and events. It's ridiculous. I don't want to get into it because, frankly, it's traumatic. If you are a care provider, you do not treat your patients like they're stupid. You do not treat your patients like they're bad people, like they're below you. Okay, that means you are projecting things that aren't there onto the person. You have an imagination and you are creating imaginary scenarios. Okay, let your empathetic colleagues teach you. To have empathetic intelligence, you have to have more objectivity. Critical thinking, not criticizing thinking, not judgmental thinking. Discerning thinking. So that's important in any relationship, in any community. That's basic civility. But man, in care providing and first responders and caregiving, for God's sake, please. And if you are in a hiring position, this is really important, especially if you want to avoid lawsuits, because there's so many lawsuits because of this kind of thing. So if you're in a position that's administrative or any kind of, CEO, anything like that, or a professional, if you want to avoid these lawsuits, empathetic intelligence. Do not project bad character onto your clients and patients. Do not assume things about whatever they're experiencing or whatever their symptoms are. Don't project. Don't have imaginary scenarios in your head. Don't let your employees do that. Don't just be always avoiding accountability either. Don't make CYA your whole... Oh my God. And quit watching the cop shows. Quit watching the TV shows where everybody's like, rah, 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 rah. Oh, everything's very, very important and I'm very important and this is the most important, blah, 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 blah. Quit watching those. Have empathetic intelligence. For God's sake. For the sake of your family and my family and our friends and our neighbors and everybody else. And if you are one of those people who knows exactly what I'm talking about and you have to work with people who keep doing that, I'm so sorry. And I totally get it. And it is time. It's been going on for way too long. Way too long. This corporate climate, I'm sure, is a huge part of it. Take care of yourself. Take care of each other. Look out for each other. Empathetic intelligence. It is imperative in caregiving and care providing. And parenting and teaching and relationships. But man, if you don't have it in caregiving and care providing, or if your employees don't have it, your patients are at risk. All right. And so is your, don't let that happen. And I'm sorry that it keeps happening and keeps happening and keeps happening. It's not a good thing. Okay? Don't project all this negative crap onto patients with superficial information. The way they look. And also, please stop doing it in the cases of domestic disputes, for God's sake. That's just as bad. It's ridiculous, frankly. I've seen that a million times. So just stop with the attitudes, with the, rah, rah, rah. Everybody's a criminal. Everybody's a bad person. Everybody's got bad character. This is a psych case. My God, stop. If you don't want to be treated that way and you don't want your family to be treated that way, empathetic intelligence. And really, just train your people. Sorry, this just happened. I'm a little upset. But it's the millionth time, so this had to be said. And take care of yourself. Take care of each other. Peace.